you for joining me today as I talk about cognitive behavioral therapy. CBT is a very effective form of therapy that helps people learn more productive and fulfilling ways of dealing with life's challenges and obstacles. It is a systematic approach to therapy that teaches people how to deal with life's challenges much better. And my name is Aureen Pinto-Wagner. I'm a psychologist, a clinical child psychologist, and I've been using CBT for over 25 years to treat various forms of anxiety, OCD, and depression in children, teens, and adults. And I'm excited to be able to share with you today that it is a very productive and effective form of therapy that has a lot of scientific support behind it. It has been shown to actually produce change in people's lives and make them, function better and live more fulfilling lives. And it teaches people skills to help themselves. So as CBT therapists, we teach people, in a sense, how to become their own therapists and to have lifelong skills for how to handle challenges and obstacles. CBT is used for many different kinds of issues. It can be used for anxiety disorders of all kinds, depression, marital issues, substance use, eating problems, mood problems, but it can also be used for everyday life challenges. And CBT stands for cognitive behavioral therapy. It is a very logical, systematic treatment that is based on certain principles. The main idea behind CBT is that as we function in the world, it's our thoughts that affect our feelings, and then our feelings determine the kinds of actions we take. And so then those actions continue to kind of fuel the way we react to life's challenges. And that's why it's called cognitive and behavioral. Cognitions refer to our thoughts, and behavior refers to our actions. So for example, let's say I took a test and I didn't do well, and I got the results. And then I say to myself, oh no, this is terrible. I'll never pass this test. I'll amount to nothing. I'll be nobody. I'll never be able to, have a job or earn a living, and my life is going to be awful. So that's my interpretation, my way of thinking about that situation. Now, lots of people take tests and fail tests, or don't do well in tests, or do less than they expected, but it all depends on how we interpret that situation. And basically, people who are prone to interpret things in more negative ways, in more catastrophic ways, in more all or nothing thinking ways, tend to then struggle with feeling anxious or depressed, because then they feel down on themselves, and then they feel like they don't want to try again or don't want to do things. And so they stop trying, and they might, give up, and they might, run away from things that are challenging or difficult. And so CBT is a very collaborative teamwork process between a therapist and a client or a patient, where we work together to help identify goals. It's a very goal-directed treatment. So what is it you want to work on to get better at handling in your life? Because really, life presents challenges and obstacles. They're not going to go away, but CBT teaches you how to manage them better, to live your life in spite of the challenges and to problem solve the challenges. So as a CBT therapist, or good CBT therapist would help you identify what is it you want to achieve, what are the obstacles getting in the way, what are the thoughts and feelings that you have, and it will teach you skills to become more aware of those thoughts and feelings. What am I thinking? Why are these thoughts getting in my way? What is the evidence for those thoughts? Are my interpretations of situations based in fact? For instance, if I think I fail this test, I'm no good at anything, I'll never amount to anything, is that actually true? What's the data? What's the evidence? Versus actually turns out I've done really well many, many other times before. It's just this one time that it was tough. So it teaches us skills to be more realistic about the way we think about things based in reality rather than just our interpretations. And then that helps us manage our feelings better, saying, okay, I'm disappointed, I'm frustrated, but you know what? I can handle it. As opposed to often when people struggle with their emotions, they don't want to handle their feelings. They say, I don't like feeling depressed. I don't like feeling anxious. I want to get rid of these feelings and take them away. And that's not possible because all of our feelings are normal. You know, it would be nice if we only felt happy all the time, but that's not how it works. So we have to learn to tolerate our feelings, increase our ability to handle bad feelings. And in order to do that, we really have to be brave and face our fears. And that's a key part of CBT techniques, is facing up to those challenges. It's called exposure. And we may not like it, it doesn't feel good, but we find out that generally our fears are exaggerated, that we have false alarms going off in our brains about how terrible something is, and maybe it isn't as bad as that. And we can actually handle it a lot better than we expect. So realistic thinking or cognitive restructuring is a key technique that helps us reframe our thoughts in a more realistic way, interpret things a little differently, and then learn to tolerate our distress about our thoughts and face our fears, which is called exposure, or get out and engage your life and do things. Often when people have anxiety and depression, they find themselves not wanting to do things and then sitting around the house and feeling more miserable. And CBT encourages people to go out and engage their lives. It's called behavioral activation. Go ahead and do things regardless of how you feel, because it's when you activate yourself, then you start feeling better. So CBT is a set of skills that's systematic. It's not magic. So you have to be motivated. You have to be willing to practice to apply them in everyday life. And you have to work closely with your therapist. A CBT therapist generally won't force you to do things. And it's very important to find a therapist who really knows CBT. So make sure you ask the questions about their experience in CBT. Try to get an explanation from them about how they would help you, and that'll give you an idea whether it fits your understanding of CBT. The ADAA website will have lots of resources that also describe what CBT is, the different kinds of forms of illnesses or issues it helps, and places to find a therapist, including the ADAA. And CBT works really well. It's sometimes even more effective than medication. And actually for anxiety disorders, it's considered the first line treatment of choice that actually is more effective than medication. Some people do need medication, and a combination of medication and CBT can be very effective for some. Thank you.